Anytime I do a palpation, I can do it prone. I'll get right in here. It already moved a little bit. Again, I'm going to straight elbow, straight over. I'm going to feel, I'm going to spring every segment as much as I can, at least. Right? I'm going to get recheck any areas I felt were restricted. He's got a few. He's got a TL too, which will be fun to get. We'll get that side in the posture. Let's do seated scan real quick just so we can go over it. Sit on the end of the table. So seated scan. Again, he's going to sit up tall. Normally, I'm going to straddle the table and get behind him. So I'll just do it real quick. First thing I'm going to do, I'm going to reach around because I want to apply that counter pressure. It's fine if you want to do this too. It's just not, to me, it's not as comfortable. So I'm going to come around. I'm going to tell him I'm going to come around. And I'll make a joke about choking and all that stuff. But I'm going to get in here. I'm going to come back a little. And I'm going to joint play. If he's real stiff, I'll use my leg in joint play. And I'll check the other side. Same thing. Joint play through this angle, right? Angle of the SI joint is not this way or this way. It's kind of like here, almost like scaption, right that way. Then I'm going to get into, sit up tall. I'm going to get into nutation, lean forward, counter nutation, and then he's going to come up tall again, and then I'm going to go up the spine. Right, and the whole time I'm applying counter pressure. So he's stuck there. Same spots I felt there. Yeah. He has the typical student restrictions. It's hard when you get up here, so I like to do that more prone or supine. All right, now lay on your back. So if I'm going to move him A to P, slide down a little bit. Make sure that the area you're going to adjust is clear of that little gap. Right, it happens all the time. You get them all the way down there, like crap. I got to have them move. So I'm going to take the opposite arm and lay it on top. So I'm going to grab it and do like so. You can ask people to hug themselves, but they always do this. I don't know why, but that's not how we hug, right? But we do hug like that. So big hug, boom. What I'm going to check first. Pain. I'm going to put him into a stress position. I'm going to apply pressure straight down. Any pain in the shoulders when I do that? How about now? Right? I'm going to play with it some. Apply pressure. Any pain in the shoulders here? All right. So I know I'm pretty safe. I can still hurt him, so I still want to be careful, but I'm pretty safe. I'm going to have him hold really tight. If there's a lot of room, like I think Adrian's got pretty long arms, and he's like way over here, I'll have him hug a pillow, so we'll do him in a second. Real tight. First thing I'm going to have him do, I'm going to explain it, right? Some people have had this, some people haven't. I'm going to tell him, all I want you to totally relax. I'm going to pull you toward me. I'm going to slide my hand underneath you. We're going to roll back together. That's it. You can get more in depth if you want, but that's all it is. We're here. He's going to take in a real deep breath. As he does that, I'm going to roll him. Sit, relax for a second. I'm already compressing, right? So big deep breath, compress, get my contact, keep in compression, lay my body on him, and then I'm going to roll back over it. Again, I'm not going to thrust. I'm going to let you guys do that. But I'm here. I keep my compression, and then it's a little quick little boom. Not this. Watch my leg. It's a drop. Body drop, right? If I do this, it's going to hurt, right? If I do this, it's no big deal. All right. Who wants to go for it? Send it to put opposite arm on top. Big hug, right? The reason I do opposite arm on top is because that's the arm I'm going to pull as I roll her over. If I do the other way, hold real tight. Hold real tight. She's going to be fighting this. Okay, go back. If I do it like this, she's good, all right? I'm not affecting this grip at all, right? What I'm going to check first, any pain or discomfort when I push down like this. And I'm pushing fairly hard, right? I'm not like cranking on you, but you can feel pressure. Any pain there? Okay. Checking to make sure we're good. I'm going to get her whole T-spine. What am I going to do next? Compression, right? I'm going to compress. However you do the compression, compress first, She's going to totally relax, take in a big deep breath. I'm going to get my contact, keep my compression, chest on there, blow it all out. Good. Right, I don't have to do this big, massive drop. Big deep breath, blow it out. Compression, roll, bring my hands together. All right, that's it. Big deep breath. Now I'm going to get up high. Do it again. Sorry. Big deep breath. Let it go. I'm going to roll and I'm going to roll up. There it goes. Perfect. Super simple. If you get up high, start low, roll, and bring those hands together. Now we're going to check her neck, then we'll get her low back. And we'll practice that. As easy as it seems like it should be, it's not. I don't know why. It's hard for everybody. Like when everybody learns, it's like, this is so weird. And then once you do it, you're like, oh man. Right? I'm going to be tight, 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 tight. I'm going to check, 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 check. I'm going to hold. He's going to take in a real deep breath. I'm going to compress, 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 compress. Go, compress, compress, compress. Go, compress, compress, compress. Come up. If I'm going to get high, I'm going to start low and roll high. Right? Like I lost a little bit there. But the goal is here, low, start low, roll up. And then like it's right there under my hand, right? You can feel it too, right? And then it's just a boom, 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 like that. Perfect. Super easy.